Hello, I'm Michael Pierce, and this is The Human Condition. This is our segment on You Need to Know. I've been asked to talk about X-rays and imaging for doctors and patients. The concept of X-rays has come up quite a lot because chiropractors and medical doctors use X-rays differently. Not always, but sometimes. All of us use X-rays in order to take pictures of bones to see if they're broken, or to see if there are bones that are offset in a certain way, which might indicate that ligaments are damaged, or even discs or the spinal cord, or other types of joints or blood vessels that are nearby, or nerves that are nearby. We can't see those structures because with X-ray you only see bone and things that have metal in them, so like calcium and elements that are very dense. We don't really see soft tissue very, very well. So when a medical doctor or a chiropractor is looking for injury, we will often order standard medical views. When a chiropractor is looking for a alignment, they will order chiropractic X-rays, which are different than medical X-rays. Now, some medical doctors get angry at chiropractors for doing this. I think that today the radiation is so low, and the amount of radiation that we use, the quality of the X-ray machines is so good, and the quality of the film or the electronic receivers, even many of us don't use film anymore. We just use a part of the machine that just receives the X-ray image and sends it to a computer, and there's no film to develop anymore. There's no acetate. There's no actual physical film. The systems that receive that, those electronic systems, are extremely good now, and it's so little radiation that, especially for extremity X-rays like feet and arms, it's just so little radiation. We're talking about less than an hour in the sun on a sunny day. Spinal X-rays are slightly more, and certainly CT X-rays at a CT center are a lot of X-rays. MRI has no X-ray, and QEEG and EEG has no X-ray, and ultrasound, of course, has no X-ray. So X-ray is an ionizing radiation. It's a radiation that has a very powerful force that can knock electrons and particles out of position and cause mutations and cause things like, we talk about cancer. Marie Curie was exposed to so much radiation from all the different studies that she did with radioactive rocks and with radioactive cameras that produced X-rays. So if you're around an X-ray machine, you're an X-ray tech or a doctor, you need to wear a radiation badge that detects how much radiation is coming off of that camera and bouncing around the room. And you need to have shielding in that room, and all those regulations are in place. So, most people have that in place if you're getting X-rays in a doctor's office, either a chiropractor or a medical doctor. So the issue of too much radiation for X-raying the spine is really not a big deal for most people. If you're very concerned about X-rays, there were some books out there like Beating Radiation with Nutrition, where several books talk about B vitamins and the use of antioxidants to help deal with the effects of radiation. If you fly a lot, more than even an hour or two on a commercial flight, you're going to be more than 35,000 feet, and you're going to be exposed to more X-radiation through that plane than you will get from X-rays at a medical doctor's office or a chiropractor's office. So be aware that flying and being exposed on a plane above 35,000 feet does expose you to more X-rays than the everyday. We like to use CT scans because CT scans get beautiful resolution of lots of different things, and they are kind of similar to an MRI in that it's a big machine that you slide into. You can take it upright where you're sitting or standing, or more commonly you're laying down and you slide into a tube, and the camera goes around your body and shooting pictures. And X-rays are what's used in a CT scan, a computerized tomography, so that when you're done, you can take virtual slices of the person without slicing them up and see what they look like. MRI does the same idea which is tomography, the idea of virtual slicing. But MRI doesn't use radiation, ionizing radiation. MRI uses radio waves and magnets to look at how water molecules will shift and change when you bombard them with radio waves. So there's really no danger of X radiation or of ionizing radiation in an MRI machine. Now, MRIs have a magnet, of course, so that's somewhat dangerous if a person has metal inside their body. So we have to make sure that they talk with their doctor about having an MRI and whether they can have an MRI if they need one. The use of X-rays, I'd like to get back to the use of X-rays for chiropractic. When a person has misalignments or has pain or has any health condition, chiropractors want to know if their spine is aligned, and they want to know if their spine is normal. So a good skilled chiropractor can examine and adjust most patients without needing an X-ray, but it depends on which technique you use. Now, just like in surgery, there are many surgical techniques which have special names. that are, offered and preferred by certain surgeons and certain schools of thought. In chiropractic, we have the same idea. We have over 200 chiropractic methods, and they all have great ideas. They all have strengths and weaknesses. They all can be applied to patients with different utility. And certainly some of them work better for a certain type of patient and less well for another type of patient. So a doctor would do well to know several techniques and have several different types of techniques available to them. Some of the techniques require X-ray, and they ask for a particular kind of analysis, which is usually taken upright. When the person stands upright or sits upright, you can get a particular symmetry side to side and see if the person has something like a scoliosis or a curvature, or if they have malformed vertebrae. It guides the chiropractor in how to adjust the spine and how not to adjust the spine. And again, a good physical examination will usually help a chiropractor decide if they need an X-ray or not. But again, if they have one of those techniques that they've learned and become certified in that uses X-ray for every patient, that's not necessarily a wrong thing or a bad thing. Now, we don't X-ray patients on every visit. That's something that isn't usually done in chiropractic. There are very few techniques that X-ray a patient for every visit, and most chiropractic techniques seek to find the misalignment, find the dysfunction, whether it's a misalignment philosophy or a dynamic philosophy of movement, which is another story for another lecture. But whatever type of problem in the joint and the nervous system that the chiropractor is pursuing, the patient will get their imaging done. The chiropractor will see the alignment and decide how they want to align the person. And then they'll use physical signs on the actual patient after they've adjusted them and made basically a medical movement to their spine or their extremities to realign them or to free fixated vertebra or to do some type of stimulation to a joint to activate nerves and activate the brain. Whatever the philosophy is or system, it's all really the same idea. Is they're going to make a change in the skeletal structural system, and they will see if that misalignment or aberrant motion has been corrected. So by using a body system of measuring what's going on with the body and X-rays, a chiropractor can figure out what's going on with a person and compare it with their symptoms. I'm not against the use of X-rays in certain cases. If you're squeamish about X-rays, ask your chiropractor if there's a method they can use without X-rays if you're worried about it. Also ask your chiropractor to give you information and statistics on how much X radiation they're getting from your chiropractic X-rays. Chiropractic X-rays are designed to see the alignment of the person and to guide adjustments. They're not designed to get the absolute best picture that a medical doctor is looking for. It's not uncommon for people that have been in a car accident or some other type of trauma to have both a set of medical X-rays to get good visualization with medical standards of a body part, as well as a chiropractic X-ray. So they might go to a facility and lay down and get their X-rays laying down to get very good sectional X-rays, and then they might go to a standing up X-ray machine for chiropractic alignment. And so that may seem like unnecessary radiation, but if you have a clinical theory based on your physical exam and your chiropractic experience, there's justification that this person may respond well to a chiropractic series of adjustments that might correct their abnormal dynamic function or their abnormal static posture or gait and help a person's nervous system, which can then indirectly help the immune system and the endocrine system and the digestive system and the blood system and all of the rest of the systems in the body. And that's the general hypothesis of chiropractic. That's not to make broad claims. It's just to say that health comes from hygiene and wellness and maintenance. And you would align your car. Why not align your body? You don't want your organs to wear out. You don't want your knees to wear out. You don't want your spine to wear out. While diet is important, chiropractic and alignment and function is also very important, and your chiropractor can find that for you. Remember, if you like our work, please subscribe. It's free and it helps us a lot. Also, press the like button if you like what we've been doing. That is the way that helps us keep being able to do this with you and do this for you. Please give us information. Ask us if you have questions. If you want us to have a special topic, please ask us. That's what we're here for. Thank you.